All right, welcome to another episode of Medicine Mondays. So we love y'all too. Y'all know that I always say, one thing I tell y'all, as an internist, I know what I know, and I know definitely what I don't, right? And we about to venture into a topic that I don't really know much about, and I'm okay saying that, right? Like I go to sleep at night understanding that, you know what, when it comes to this topic here, women's health and beyond, like I gotta get the experts on here. We did that today, right? And this is a question that a lot of y'all have been asking me when it comes to menopause, when it comes to hormone replacement, like just that world, which again, as an internist, I don't really know much about, but I had to make sure I got the expert on here this week to come talk to y'all. So I know y'all gonna appreciate it. Dr. McMillan, first of all, thank you for joining Medicine Mondays with Dr. Barry. I appreciate you taking the time out.
Thank you, Dr. Barry. Thank you so much. I'm so excited to be here with you. I'm such a fan. I follow you on TikTok. I love your education, the way that you are like, look, I'm going to tell you the real. I really appreciate that as a colleague, as a fan. So thank you for having me here to be able to be part of your community today.
So I like to start out because obviously we'll have your bio in the description and the show notes, but I always like to give my guests and my experts a time to kind of say, all right, who am I? Right. And, why does Dr. Barry have this expert on the show this weekend? So if you can, brag on yourself, however you want to do this. This is your time. Like, who's Dr. McMillan? Like, who and what can we expect from today's show?
Oh, wow. Yes. So I am Dr. LaKeisha. I'm your international and celebrity menopause whisperer, an Oprah-owned TV network featured expert in perimenopause and menopause. And I like to say that that's the highlight reel, right? That's kind of like the nice little, check marks, but it wasn't always like that. Love to be able to let people know I came from a 2-parent household from Huntsville, Alabama, as some people would, be.
I have family from Brundage.
Okay. So, the Southern girl, went to Oakwood College, now Oakwood University. And like I said, if you look at my highlight reels, it's like, oh, she checks off all the boxes. I got accepted to medical school early, knew I was going there from my junior year, had always said I wanted to be a doctor from around 12 years old. I remember looking at a video that my mother brought home because she was doing some volunteer work at a community center, and they were talking about the miracle of life or birth. And I remember sitting there watching this video going, oh my gosh, that's so cool. Like you can help people deliver. Like, I want to do that. My parents were like, we're educators. We are not doctors. You need to find yourself around a doctor to make sure that's what you want to do. So from the time I was 13 years old, Dr. Barry, I was able to go to Dr. Hicks' office in Huntsville, Alabama, twice a week. The old-fashioned charts that you had to look at the numbers, find the name, pull it out.
You don't even realize how big the back rooms used to be.
Oh my goodness. Okay.
Just like, hey, all right, go find the chart in the back. And you literally had to go find that chart. It was like,
exactly. So I started doing that. I was able to graduate up to answering the phones, to booking appointments. When I was able to start doing rounds with Dr. Hicks, he would let me go in the summertime and go on rounds with him in the hospital. And his alma mater was Loma Linda University. So that's how I got connected with Loma Linda through their early selection program. So knew from a very early age that women's health, medicine, that was my calling. I felt the call for that.
Shout out to Dr. Hicks.
Exactly. And he still checks on me to this day. When I go home, I have to go by Dr. Hicks' office to just check in and make sure and let him know I'm doing okay. I'm doing all right. Now, life hits you, Dr. Barry, right? It will come and it will slam you down. It will give you a 1-2 punch. And for me, that happened between 2009 and 2010. April 2nd, 2009, my husband had to come to the hospital and let me know my father had passed away from complications of a stroke. It was one of the worst days of my life. I felt as if the rug had been ripped from underneath me. And then 10 short months later, my grandmother passes away from complications from CHF. Oh. And I remember standing at her gravesite, looking 2 plots over, and the grass hadn't even grown up over my father's grave. And I was just like, this is just unfair. Like, just reevaluating all the things, right?
Yeah, especially you start thinking like, all right, what's really important?
Important. Exactly. You really start asking yourself, I've been married to my husband at this point for about 8 years. We have our first child. We're talking about expanding our family. And I'm really like, okay, what is the meaning of all this, right? I remember, Dr. Berry, at one point, so fast forwarding about a year now after my grandmother has passed, I'm sitting on labor and delivery one night. My blood pressure is 160 over 110.
Wow.
And
Okay.
the nurses are like, do you need to go downstairs to the ER? Like, are you okay? And I was like, no, I'm good. But I remember sitting there going, I need an exit strategy. This is not where I'm supposed to be anymore. So I took a sabbatical.
You know what I love about that is because a lot of times, you know it, in our profession, a lot of times we won't recognize that there's a window that we're supposed to step out.
Yes, yes, yes. And I remember clearly going, you either need to take that step away or you're going to, unfortunately, end up like some of the doctors you've seen before you. Those attendings that came in residency and taught you, and you started learning about their lifestyle or their lives or the lives outside of the hospital. And I was like, that's not what I want to do. And so 2 months into my sabbatical, I remember calling my office manager and she finished the sentence for me. I said, she's like, you're not coming back. She said, and it's okay. And to this day, Dr. Berry, she is one of my favorite people to talk to. And she's a big supporter, super encourager. And she's just like, I'm so excited to see what you've done. I'm so excited to see how you've pivoted. And that's what happened. I took a step back. I did that whole old adage, physician heal thyself first, where I started diving into integrative medicine and functional medicine and understanding why I was feeling the way I was feeling. There was a lot of grief that I was peeling back those layers of, but there was also a lot of physiology that was changing. And I was gaining weight, didn't know why. I didn't want to be intimate with my husband. And to your community's point, y'all, I love my husband. He is fine. He's cute. And I was just like, what is going on, right?
Something's definitely wrong.
Definitely not right. Okay. And I was not feeling like myself. I literally felt as if I had put on another person's body, like zipped up in another person's outer suit. And so doing this, taking this dive, doing some extra studying, understanding hormones and how the changes affect us as we get older, particularly with women, really led me to being this international celebrity menopause whisperer. And that's what I love being able to do today, helping women that are in this phase of life validate their symptoms for one, because there's such a big array.
That is such a huge word. And I wonder, was it the sabbatical that gave you the time to get to that level? Or were you having some of these kind of thoughts kind of burning in you even before blood pressure was rising? Or was it like you needed that sabbatical to really kind of wrap your mind around that aspect of validation? Because especially in Lunch Mondays, we're very real. In the Black community, we run into a lack of validation when it comes to healthcare. And very often we say, hey, I have this problem, and the medical system is saying, no, you don't.
You don't. Right.
I love that you use that word, like validation, because sometimes we are searching for it and we go from place to place not finding it. I'm very excited that you were able to get to that level where you say, you know what, I got to validate what's going on here. And I think with all of the things I'm doing, I'm almost there. So I apologize for interrupting.
Oh, no. Great question. And I see your trend of thought. And I'm so glad that we're taking this side street, so to speak, but it's part of the main conversation. I feel that I was already practicing a little bit of this because Loma Linda's motto is to make man whole. And so their teachings around medicine tend to be more of look at the entire person. It's one of the blue zones that has been studied for longevity. And so being in that environment, I think, was the foundation that kind of planted the seed. So I was always, when somebody would come in, for example, I have patients come into my practice before I left what some people would call traditional medicine. And they would say, my period's been weird for the last 3 months or so. I don't know what's going on. And I would stop and say, well, what changed in your life 3 months ago? And they would look at me like, well, what does that have to do with anything? That has a lot to do with everything. So tell me, did you change your job? Was a relationship? Did you end a relationship? Tell me a little bit more about your story, because we are learning that our body keeps a score. And if we don't dig into that story, we cannot crack that code and be able to then rewire the pathways so that then the physiology can work the way it's supposed to work. So it was a little bit of a grain that was probably planted there from the way that the curriculum was presented. And then it was my own curiosity and the way my brain works that I finally actually embraced this beautiful ADHD brain that I have that thinks in creative ways and connects things, that I was able to present and show up in a very unique way in this space at this time.
Well, I wonder, because my wife's neurotypical as well too. So I wonder if that, just you being neurotypical, because, especially in, how our colleagues are, a lot of times we get so focused with just kind of our thought process and we won't change it. We won't adjust it, that, we'll run ourselves to the ground because we just won't change our thought process. So I wonder if just being atypical also kind of aided you in being able to kind of make that shift in the direction you needed to make.
Absolutely. I used to always say when I was younger, I'm going to be a doctor, but I'm not going to be a traditional doctor. I don't know how that looks. I don't know what that means, but I marched to the beat of my own drummer. I knew that inherently, didn't know what the label was. And once I got my diagnosis in 2012, after having our second child, and I'm way out of education, traditional structure of education, finally sitting with my psychiatrist, and she goes, my dear, you are classic. I finally got that validation and my entire life made sense. It was like, oh, okay, now I can take this as a superpower and go over here and help somebody else. It's almost like I've run down the road, saw what's going to happen. So now I got to go back and tell the ladies what's coming.
What's going down. Ooh, I love it. First of all, I love this International Menopause Whisperer. I love that. So how did we get there, right? So we're in a sabbatical. We're obviously learning, about ourselves, right? Because that's what it sounded like. I was focusing and learning about myself during this time frame. How did we get to the other side of the road where you look back and say, you know what? I got a story to tell everyone else.
Yeah. Oh, wow. So digging in, finding information, I actually went back part-time to a wellness center that had the ability to help women and men with hormonal imbalances, and getting into that space, but still having the flexibility in my schedule was amazing. So being able to still be mom, the ability to still be wifey, you know what I mean? The ability to still be sister friend and daughter and sister, the ability to do that was amazing. It was invaluable. And so I was able to then be open to opportunities that came my way. So one of the things that I learned was that I love teaching and I have this natural ability to teach and connect. And it came out of therapy, after going through therapy and realizing that. And that's when I launched my first podcast, House Call with Dr. Mac. And that's still out there. If you ever want to find it, it was out there just having medical conversations. And then I just kept saying, I know that there's something else that's going to help me to be able to harness all the different parts of what I'm getting. Like, oh, there's women's health, there's the doctor, there's the teacher part. And that's when I found my business coach. And that was a serendipitous moment where I actually found him on Twitter. This was when I was booking guests for the House Call with Dr. Mac podcast. And I came across this person that called themselves America's OBGYN, Dr. Dre. And I was like, wait a minute, I'm an OBGYN. I don't know you. How are you America's OBGYN? Like, how did you get that title? Like, who are you?
Shout out to Dr. Dre.
Right.
Medicine Monday, the Lunch and Learn community for sure knows how much I talk about Dr. Dre and like how important he has been, and really the foundation of who Dr. Barry is online, right? Like,
absolutely.
Shout out to doctor.
Absolutely.
Shout out to doctor.
So this is what happened. I was open to the next. And so after he came on the show and did his episode, he was like, you need to come to my conference in Atlanta this weekend. And I was like, wait, what? Well, needless to say, the timing wasn't right for that. A friend reintroduced me to him because she had met him at a conference and was like, you have to meet this doctor. I so see you being just like him. Oh my gosh. Reintroduced us and we're like, we've met before.
I love it.
And the timing was right.
Degrees of separation. It just like sometimes fate just happens that way. Like, you know
That's
what?
it.
You went away for a little bit. Let me make sure I bring you right back over.
Come back. And this is where, when you talk about serendipity and you talk about your path, at one point I thought I was done with women's health. I actually thought that was part of the burnout. I thought, oh, I don't want to do women's health anymore. There's something else. But no, it was, I needed to see it through different eyes and lenses. And so being coached by Dr. Dre helped me to be able to start realizing, oh, this is the aspect of women's health that I'm really starting to hone in on. It is this next. It is the Talk 2.0, or what I have coined, the phrase I've coined, the other PMS. We know about premenstrual syndrome, but how many of us know about perimenopause, menopause, survival? And so there is this other PMS. And that's the title of my book, The Other PMS, Your Survival Guide for Perimenopause and Menopause. And being able to have this person help you to kind of dust off and see clearer and guide you has helped me get to this point of being able to be the celebrity doctor to celebrities, to be able to be the doctor to women. And like I said, validate their symptoms, but also give them tools, create for them their hormone hottie handbag so they can reach in there and grab whatever tool is right for them at that moment.
First of all, I love that. A question that tends to hit me, right? I don't know why it keeps hitting me. My women followers, right? They're like, Doc, I think I'm going to menopause. I just turned 40. I just turned 45. I just turned 50. When does it occur? And I always say, you know what? I don't got a clue. You go to get an expert. And now I'm going to ask the expert, like, is there an age? Is there some defining, when I turn 42, this is going to happen? When we talk about menopause or perimenopause, how would you describe just from a timing standpoint for the women audience who may be thinking like, all right, I think I might be there?
Okay, Dr. Pierre, you know this is my mountaintop, my soapbox. So you're going to have to give me the 20-second timeout,
of course.
type of thing, you know. Oh my goodness. So I love this particular question because most people believe it is due to a number. Perimenopause and menopause is age related. That is only a piece, a tiny piece of the puzzle, because when you get to certain ages, what starts happening is your hormones start changing. The hormone levels start changing. So let's get some definitions here. Menopause is 12 consecutive months without a cycle. You're not on hormones. You're not on birth control, nothing. 12 consecutive months, no cycle. That's the textbook definition of menopause. It's not hot flashes, night sweats, vaginal dryness, 12 consecutive months.
Okay. So it's just a timing. It's not even, all the symptoms don't even matter. It's just.
No, and we'll talk about why the symptoms don't even matter. It is 12 consecutive months. And the reason too is because if you go 12 consecutive months without a cycle and you're not on hormone therapy, you're not on anything exogenous, and you have a period, you need to be evaluated to make sure you don't have uterine cancer. Now, I'm not saying that a postmenopausal bleed means endometrial cancer. What I'm saying is that we have to rule out endometrial cancer as one of the causes of postmenopausal bleeding.
Indeed.
So now perimenopause, I call that purgatory. I say, welcome to purgatory, because perimenopause is where you can have these changes in your hormone levels that can last for 5, 7, 10, 15 years before you have this total cessation of your period.
Years.
So, yes. And there are so many different symptoms of perimenopause because of how everybody's physiology is. So, for example, some women will start experiencing their sleep being interrupted. And that can be one of the big hallmarks of, oh my gosh, something's going on, because their progesterone has started dropping. Progesterone is that wonderful hormone that starts the cascade for you to start going to sleep at night. And it interacts with other neurotransmitters in your brain and plays tag team with other hormones so that you can get the restorative sleep, so that you can wake up feeling refreshed with your tank full of the right form of cortisol so you can get going with your day. But other hormones that start changing are your estrogen, your testosterone, your adrenals start getting messed up. Your thyroid function can also be impacted. And so with all of these different symptoms, you can have a variety of almost 100 different symptoms, Dr. Berry, is what we're finding. It can show up like mood swings, of course. Somebody saying, oh, I just don't feel like myself. Weight gain because you have insulin resistance now. You can start having some lipid issues because now with the insulin resistance, you may start producing more androgens. You might have hyperandrogenism that's happening. And so now you're actually creating more steroid genesis in the adrenals and you're increasing your cholesterol. You may also start having some low-grade chronic inflammation. So your gut doesn't feel good anymore. You wake up and your fingers are swollen. Your joints hurt because the anti-inflammatory properties of progesterone and testosterone have decreased and you don't have that protection anymore. Your skin feels different. Dr. Perry, let me tell you, this is where women start saying, my clothes don't feel the same, or they don't even want their partner touching them because it just does not feel good anymore.
Wow.
You can start having decrease in vaginal lubrication. So that can be that vaginal dryness. And some women start having tear ducts are starting to dry up. They start having issues with their eyes. They start having itchy ears. You can start having some vertigo. They start losing their hair. Their hair texture changes. Their skin texture changes. And so all these little subtle things, a lot of people have just lumped them together and said, girl, you just getting old. Welcome to 40. Welcome to 50.
That's where that validation keeps getting missed because
yes,
they're saying, hey, I got these issues. And I'm like, how
and it's like, right. So these can start happening in your late 30s to early 40s. And then you go get your test done, you go get blood work done, and you're in the range. But our hormones are changing all the time. So this is where I do different types of testing, may do it at different times in a cycle. If someone's still having a cycle, perimenopause definition too is when a woman's cycle changes by 7 days, plus or minus. So they start coming closer together or further apart. So that's a textbook definition. But most women will say, the studies have shown that most women will enter full-blown menopause, that cessation of your cycle, around age 54, 55-ish for most women in North America.
They could be dealing with all of those symptoms for almost a decade before they even get to the textbook definition of no cycle for a year. You having no cycle for a year, we didn't even mention what symptoms you may be having during that. It's just that you just not happen to have a cycle, as long as there's no other reasons why you don't have a cycle.
Exactly.
So I can see where purgatory comes in at. Especially they run into an internist like me. I'm like, all right, cholesterol a little high. Take this lipid lowering medication.
Right.
I'm not actually addressing the problem, right? Like I am dealing with the end result. Oh, maybe the thyroid is a little off. All right, maybe some lotion, maybe skin's a little dry, but I'm not really actually solving the problem. I'm just kind of putting Band-Aid on the end result of the original problem.
Exactly. I say to women all the time, I said, do you feel like you missed a memo? Because they literally feel like they woke up one day and they are in a totally new body. And they're like, wait a minute, did somebody send out a text message or something that I didn't get? Because it literally feels that way. You know, I was talking to someone the other day, another woman influencer that's in the menopausal space, and she gives ability for women to kind of get new tools to be able to figure out how they're going to navigate life. And she said, I know that it didn't happen overnight, but things are so minute that the compounding effect it happens overnight. Because like you said, my skin's dry, I'm not sleeping. So these little things start building up. And so now you've got this nice big pile and you turn around and you go, wait a minute, when did this happen? When did I get here? And then you're getting told, oh, go exercise more, eat less. You're told, oh, well, you're on your phone too much right before bed. That's why you can't get to sleep. You're told when you get up to go to the bathroom in the middle of the night, come back, don't do anything else, don't turn on the lights, just go to bed. Not understanding, well, that switch got flipped and you're like, bing, I'm up.
Yeah, we're not sleeping anymore.
No. And then you have women that now it's impacting how they show up in their worlds. It's impacting their relationships. It's impacting their communities. It's impacting if they're working outside their homes or working for, somebody else. It's impacting how they do that. So the woman that used to run the C-suite with ease can no longer read the reports and be able to spew it off like that. We have this saying now, I have a patient and she's actually in TV. She was on my podcast a little while ago and she says, when I'm on set and I forget my lines now, I just go pause for the meno. Just pause. Just give me a second. She's like, because people are looking at you, they're getting impatient. They're like, can you? And she's like, just hold on, And this is where when we have this bigger conversation, more people are a part of the conversation and they can then give somebody grace. Because they know, oh, okay, she just needs a little more time. She may need flexible hours to come into work, may need an assistant, just little things that can be very helpful.
Is it a combination, especially of people being left out of the conversation from a healthcare perspective or the patient community? Like who is more left out of this conversation of dealing with perimenopausal symptoms and just recognizing it? Is it that the healthcare community don't really know much of what's going on, so they can't really address their community? Or is the community still kind of oblivious of what maybe be able to go on and they can't really talk to the healthcare provider in a way that kind of leads them both down the right path?
Oh, that's a juicy one.
I have an idea who.
You have an idea? In my experience, it's both.
Okay.
And I'll tell you what, from the provider's perspective, I believe we are victims of the WHI study that came out in 2002. And I say victims, and I say it this way because I was an intern when that WHI study came out. And I remember my program director running into Morning Report, waving it, going, oh my gosh, this was FedEx to my home. We have to take everybody off. We have to stop it. We have to stop. But there was no follow-up conversation. So the Women's Health Initiative had 3 arms to this initiative. It was the largest health initiative to date to study morbidity and mortality for women's health, why women started having long-term care issues or dying early or dying after they went into this phase of life.
Right.
Like, what is it? And they found out, one, that the 3 big causes for morbidity and mortality in women was 1, cardiovascular disease, 2, osteoporosis, and then breast cancer. And breast cancer, it has a great PR department. That's why a lot of people get stunned by these numbers. They're like, oh, I thought women were dying of breast cancer. No, women are dying of heart attacks and strokes.
I don't even mean to laugh, but it was so funny that you said that because I talk about this all the time. If I'm like, this month's mental health awareness month, and I say we don't got like the the lobbyists like breast cancer awareness month does, where everyone dolls up in pink, but like we should also focus on mental health. So I love that you said that.
Yes,
because it is true. Like
it is true. It's true, and I'm not trying to say that it's wrong. I'm just stating the obvious. They really have taken this and said, hey, we need to make awareness for this. And they've done that. What we also need to do is say, okay, now let's take this information we learned. So WHI was Women's Health Initiative. There was a hormone arm to this initiative to see if they could prevent women from having a secondary cardiovascular event by placing them on hormone therapy.
And I'll tell you from an internist standpoint, election learning community, the way they kind of presented it to us was that women had estrogen. Estrogen's been protecting them forever. And once the estrogen, this is how they simplified it. I knew it was simplified, but once the estrogen went down, then all of a sudden the risk for cardiovascular disease, all these things kind of tumbled down because the estrogen went down. That's how they simplified it. us. I knew it was too simple, but they knew that we were internists, so we probably wasn't going to go down the rabbit hole that y'all needed to go down. Just for my community to understand how the internists took that information.
But it's really correct. Like, that is really a great way to start. And so this is where we're going to come back to that. So hold that point, because what they did was they used synthetic hormones. They used conjugated equine estrogen from a horse and progestins, which are synthetic, and said, hey, let's give women these things and see if we can create the protection they need. When you use those type of molecules, of those type of chemicals, we had bad results that happened. And what happened too was that epidemiologists came out and tried to explain the results nationwide. And when you try to explain statistics to people that haven't taken statistics, it gets lost in translation.
Yep.
So what happened is that everybody just stopped giving women hormones because there appeared to be an increased risk of breast cancer when women took the hormones. And we saw an increased risk in PEs, which is pulmonary embolism, and DVTs, which are your clots in your legs. So what happened after that? There were studies that came off of that. And so what we found was the progestins that were combined with the estrogen is what made the statistics look like women had an increased risk of breast cancer. There has been review that has been done here recently that came out in 2022 that said, it was not statistically significant. What that meant was your risk of breast cancer was not over your risk of just being a woman, right? It was still your baseline. So, okay, we have that. Now, what else did we not say? Well, the average age of the women in that study were 63 years and older and had a known cardiovascular event. So how do we take that and put it out in the wild to women that are perimenopause and women that haven't had stroke? How do we take this information? What I saw was somebody had taken a graph and looked at women's health and how this WHI study impacted women's ability to have a conversation or have one of the tools given to them as hormone therapy. It has dropped significantly and has never gotten back up to those pre-2002 levels. So it's not even part of the conversations, really. We have other tools out here. We have bioidentical hormones that you can use. What that means is that it looks just like what your body used to make, and it knows how to break that down, use it up, and get rid of it appropriately.
Underutilized still?
It's still underutilized, and it's not part of the conversation even. So that's why I said from a practitioner side. From patient side, our mamas didn't tell us anything. Most of us have not had the Talk 2.0. We are saying that we are...
Hello, I like that.
Hello. Everybody gets the talk. Your body's changing. You're going to experience certain feelings. This is a period. This is what we get that talk. And even the generations that, Gen X, and we've even gotten fancy with it, giving our young ladies their rites of passage boxes or making it a day or, really talking and making it feel like it's nothing to be ashamed of. Because my mother's generation and before, you didn't talk about that stuff.
Right.
It was quiet. Now, I have a mother that is amazing. And so I tease her all the time because I'm like, your mouth, sometimes you just share too much. I mean, seriously. But, she was like, I'm going to tell you what to expect. But then there really wasn't a lot of talk about this is what happens because they didn't have the verbiage. Like perimenopause is a new word in our lexicon to even talk about what happens leading up to. In residency, we may have had the term premenopause and talk about it just a little bit, but that was it.
When I needed to send the OB. Like,
right, that's it. Oh, go to the OB.
Okay.
Right. So giving women the ability to have validation and say, hey, yes, these are symptoms that a lot of people used to say, hey, you're just getting older, you just have to live with it. But helping them understand it's a physiological change that happens that is giving you everyday symptoms. And then having the medical community acknowledge this as well and say, oh, okay, we really have to look at women in this phase of life a little different differently. We have to be able to say, okay, there are certain things that are going on and we may need to address, their cholesterol a little differently. I know when I actually help women get their hormones balanced, their cholesterol starts dropping because their adrenals aren't pumping out that cholesterol as much anymore. I know that when we talk about really looking at this new stage of life for most women, this is where people have that reflection. They're like, okay, what am I going to do with my second half of life? This is where you start really looking at what gives you sanctuary. Where do you go to refill your cup? Because you need to do that because the physiology needs you to do that. It needs you to be a little more gentle with yourself. You're not 20 years old, going all the time. No. You need to stop. You need to pause. You need to have this rejuvenation and ability to really go, okay, now what do I do?
Are these stages inevitable? Like, is there, like, as you're gonna hit perimenopausal, you're gonna hit menopause, outside of, the obvious reason why you wouldn't. Are these stages, like, it's happening, right?
Yes,
and
sir.
I know you mentioned, like, talk 2.0. Like, this isn't a talk that some people may be able to get away with. Like, nah, you need to have this talk because it's gonna happen one way or the other.
Absolutely. Now, the intensity to which you experience it will be different. I totally believe in there being a spectrum of intensity of the ability to experience certain symptoms. And this is a great question because some women feel that they didn't go through menopause because they didn't have hot flashes, night sweats, or vaginal dryness. Like, oh, I missed menopause. No, ma'am. Menopause is, and some people like to use the term post-menopause. Oh, I'm post-menopausal now. I personally stopped using that term with my patients because I saw that they felt like they were through something. They were going to go back to how their body was before menopause and then got frustrated because, well, I'm trying to lose this weight or I'm trying to do, or I can't sleep. Well, there's total cessation of the hormones you used to make now. So now we need to give you different ways so that you can now navigate this new body to feel like yourself again. And it may be having bioidentical hormones. It may be certain supplementation that you need to do. It may be as big as changing directions in your life's work. These are big conversations that you need to start having. And so I personally stopped using the term postmenopausal with my patients. I just say you're in your menopausal phase of life. Women will spend a third of their life in menopause.
I like that. Your menopausal phase of life. Like, this is it, y'all.
Yes. So I had to start looking in the mirror too here recently, and more recently after I launched my latest podcast, the Hormone Hottie Hotline. And I actually have a segment called Confessions of a Perimenopausal Doctor because I'm in the fight with y'all. Right? I'm like, oh, if somebody came to my office saying what would you say to them? I was like, okay, get your hormones checked. Oh, ooh, really? Okay. So being able to be there with them and experience this and say, well, these are some things that I'm doing. These are some things I'm recommending to patients and I'm seeing that they're having success with. I think it's creating this community. It's creating the ability to feel that you're not by yourself and you're not on an island and experiencing this in a vacuum.
No, I love it because we're going to segue right to there, kind of some of the recommendations. And you kind of touched on it. And again, because, you follow me on TikTok. So a lot of times, right? Let me tell you something. I don't know if they hate follow me. I'm not sure what it is, right? But like, there's a lot of people who are kind of anti, especially Western medicine. For some reason, they're anti-Western medicine. So they are very pro vitamin supplementation, other supplementation that doesn't necessarily have to deal with the hormones per se. They want to hear the other options as well. And I know obviously you do functional medicine, integrated medicine. I know that's in your wheelhouse. I hear that a lot, even when I'm talking about high blood pressure, diabetes. Like, that's cool that you about to prescribe me something, but what other things can I take?
Can I do?
Like, what vitamins can I take? What supplements can I take? Is there a lane for our women who are in the perimenopausal, menopausal phase of life? Two questions. Is the perimenopausal phase, does that include the menopausal phase of life? Or is that like kind of lead up to it?
That's the lead up. Lead up to it. Yeah.
So is there like vitamins and supplements that can also be added to? Because I know you mentioned hormones, and I do want to ask is, are there people who probably can't do the hormones? Like, because I know they're going to ask me. I already know that's going to be a question like, what about vitamins? What about CMOS? Shout out. And again, I'm not mad at the CMOS people, right? Like, no. I just always bring it because CMOS is just one of those weird. Again, I'm outside of medicine, so I understand. Like, whenever I hear that y'all eating CMOS, I got questions. I'm like, CMOS, like, okay, like, all right. If y'all say it works, cool. It's just a weird thing for me. But like, if the CMOS is working, I'm all here for the stuff that's working. Like, is there, a lane for like vitamins and supplements and stuff like that for your women?
So glad you asked, because yes. So even with you using bioidentical hormone replacement therapy, there are what we call cofactors. And so if you think about the vitamins, minerals, phytonutrients that you're getting when you eat properly, and our food supply may not be the best all the time. Having supplements like magnesium, selenium, iodine, there are some great vitamins that literally help your cells process the hormones properly, or even help so if you're perimenopausal, and depending on your symptoms, and this is where it gets really personalized, depending on your symptoms, depending on what your labs show, depending on where you're headed, like, because I come in and ask you, okay, where do you want to go? Like, what's the end point? What's your end game?
I do like that question.
Oh yeah. I'm like, I'm in the passenger side. I'm going to put in the GPS coordinates. You tell me where we're going. I know how to get you there. So you tell me, oh, well, I just want to be able to sleep better, or, whatever it is. And I'll say, okay, according to your labs, you're not optimal. This is how I feel you can get optimal. There's some women that, depending on their lifestyle, what's the demands of their life, you can do supplementation, lifestyle changes, and get this balance back to a point where you feel really great. There's some where it's like, okay, we need to add on, maybe you need some bioidentical hormones as well as the supplements so you can actually get an optimal result. So there are supplements that I will put patients on with or without them being on a bioidentical hormone therapy protocol too.
Okay, because I already know they're going to ask me.
Yeah. And I know people are going to say, well, what are they? And that's where it becomes personalized too.
Right. That's when they got to come see you, right?
Exactly.
Exactly. So when do you feel is the best opportunity for someone to come knocking at your door? Like, when is a good time frame for them to say, you know what, I got to see Dr. LaKeisha?
Dr. Barry, your questions are amazing. I love this. We could sit here all day and chat. So I say, whenever you feel that something is not right or off, or you are not yourself, if you are starting to have more than one sleepless night in a row and this is not you, because I have patients that'll come to me and say, well, I've always had trouble sleeping since I was a kid. Okay, that's a long-term thing, right? But if somebody says, oh my gosh, 2 months ago, I started popping my eyes open at 3 o'clock in the morning. I call it the come to Jesus hour, okay? Because they're like, do I need to get up and pray or something? Like, is somebody tapping me to say, that type of thing? And they're like, and it's happening more than once. I'm now exhausted, or I'm fatigued. I can't even tell you the type of fatigue I'm having. My brain fog is horrible. I really think I have early onset Alzheimer's, or something that is now interrupting your life. Come see me. You do not have to white knuckle this through. You don't have to just hold on for dear life and all these symptoms will pass. There are things you can do so that you can show up. You can fire on all cylinders, as somebody would say. You can be in your wheelhouse, as others would say, feeling yourself, however you want us to call it, where you feel like you are back in your skin and you're like, yes, I'm doing what I need to do today.
And especially because, you talk, some of these symptoms may last 3 to 8 to like
a long time.
So you just trying to fight through it because like, all right, this will pass. This is another month.
No, it won't.
2 months, 1 year, 2 years. Like,
and that's the thing. I can't even tell you how long your symptoms will last. I was at a conference last June, I think it was, and they were talking about a medication that was going to come on the market that is actually out there now for people that cannot take hormonal therapy. It's a non-hormonal treatment for hot flashes, for moderate to severe hot flashes. And they introduced a study that they used in their research that showed that women of different ethnicities, their hot flashes, because this particular drug was talking about hot flashes, their hot flashes have varying lengths of times that they will literally have these hot flashes. Like, I think it was Black women have hot flashes, and these were self-identified ethnicities in the study. They said that their hot flashes flashes, when they looked at it, lasted about 5 or 7 years longer than other ethnicities. Then there was the Latinx that was next, and then white women, Caucasian. I mean, so everybody is different. I know that there's another CME that I took, and they were talking about how different cultures don't even have a word for menopause. So we're dealing with this spectrum of people that don't even have a word for menopause. There are people that really embrace it as this new time of discovery, and they don't really see it as a loss. There's some women that see it as a loss. I mean, there's such a big array of feelings that even go around this.
And that's why you're the international listener, because you got to be able to guide us through.
Yeah.
Because again, I'll be honest, I am learning just as much as probably as a lot of my community members.
Yeah.
As an internist, I've been doing this for over a decade. But like, again, I recognize when I hear hot flashes, I get, whoa, okay. Let me find my OB. I gotta know what test to order. But like, there's no point for me to order the test because I'm not going to be able to interpret it the way it's going to need to be interpreted anyway.
Exactly. You know, I really applaud you, Dr. Berry, because as physicians, we are traditionally trained to always have the answer, right? To come up with our differential diagnosis and say, okay, it's this one. And so because it's this one in the flow chart, I'm going to go over here. And if yes, go here. And if no, go here. And if yes, go here.
Shout out to the flow chart.
Flow charts, right? And when I learned pretty early in my craft of being this healer. So let's say what we intuitively know us to be.
I love it.
The ability for me to say, I don't know, was just as impactful and powerful as, oh, I know what to do. And being able to say, I don't know, and was also even greater. I don't know. And you know what? Let me go talk to a colleague. Or I don't know. And let me do a little more reading. And that's why I really love doing what I do, because now I get to do it on my own time. And I'm not beholden to somebody's schedule that's knocking on my door because my 15 minutes with my patient is up.
Talk to it. Talk to it.
And I can really sit on that proverbial floor with this patient and we can comb through some things. And I can go, oh, okay. Did you see this? Did you notice this? Okay, let's connect some of these dots for you and really see the moments happen.
Dr. LaKeisha, before we let you go, right? Because one, we gotta somehow get you on the show again, right? We're gonna find a way. We're gonna find a way to get you back on the show for sure. But I need people to know, like, how can they follow you? You kind of mentioned a podcast. What are you doing with your life? I know you're busy, but how can people follow you? I don't know if you do virtual or it has to be local. Like, how can people get connected with Dr. LaKeisha? Because they're gonna take a lot of people are gonna take this message and say, all right, I knew something was wrong, right? Yeah. And I have been validated because Dr. LaKeisha has validated to say that the symptoms you are experiencing are true, and these are the reasons why. How can people know where you're at, follow you, consult you, book you? What's going on? How do we make sure this happens and continue?
Oh, thank you, Dr. Berry. Thank you so much. First of all, I have had an amazing time sitting here having this conversation with you. I really appreciate your ability to have a full conversation and allow this full conversation. So if you want to,
I don't think this something can be rushed. You can't really rush this.
No,
this probably could be multiple parts. Like, I mean, it's such a big phase of life. The menopausal is such a huge and long time frame, and having to kind of deal with every step of the way. I think that's why we have to make sure platform is available to give the platform its due.
Absolutely. Oh my gosh. So if you want to be one of my hormone hotties, that's what I call my ladies. If you want to be a hormone hottie, you can follow me on all platforms at Dr. LaKeisha MD. That's DrLakeishamD. And if you are struggling with feeling validated as to what's going on with you in terms of your symptoms and you're not quite sure and you really just want to be able to talk to somebody, go ahead and schedule your virtual consult visit with me at talkhormones.com. And if you still just need a little bit more, you're like, I'm not sure, I need to do a little bit more digging, go ahead and crack your hormone code by taking my hormone quiz and go to hormonequiz.co. That's hormonequiz.co and crack your hormone quiz.
And remember, listener, community members, Medicine Money Watchers, everything she said will be in the description, will be in show notes as well, too. So in case you're driving, riding, whatever you guys happen to be doing, go to the show notes, go to the description. You'll be able to click the link head you right over there. I think this is such an important conversation, especially because we follow each other on TikTok. So like, I know the information and game you putting down, and I'm just like, oh, I know they're eating this up. And I could tell in the comments, I could tell in the questions. Typically, people be asking me questions, and I'll put your username in, like, hey,
I get them.
See what you mean. Because I think it's such an important conversation, because there are a lot of people who are walking around, a lot of women who are walking around and just not feeling validated with their symptoms, being told that, you're getting old, you're just anxious, this just happened, it just work. And they're getting piecemeal together. They're getting put on a blood pressure med. They're getting put on anxiety med. They're getting put on all of these meds, but not really that holistic approach of, all right, I see all of these things kind of going around here. You know what? Let's look back. Let's think there's something else may be happening that's attributing to it. So I love that you're going out on your own and saying, you know what? I'm going to be a crusader. I'm going to talk to the hormone hotties. I'm going to get them to where they need to be. And it's really the step, especially in healthcare, it's about validating. I'm going to get them the validation that they've been looking for, because clearly, some of our colleagues, myself included, aren't doing a good enough job getting them to where they need to be.
Thank you so much, Dr. Barry. Thank you so much for that validation. I really appreciate that.
And remember, all the information will be in the show notes. We will bring her on whenever you got something to talk about. Floor is definitely yours. I think it's such an important, just women's health in general, but I think it's so important just to, have our experts on here, the spitting game. So I appreciate you for taking time out and joining Medicine Mondays with Dr. Barry.
Thank you.